Welcome to SimplyRN. Today we will be talking about pulmonary embolism, or PE. PE is a potentially life-threatening medical emergency that occurs when an embolus, which is a blood clot that is formed elsewhere in the body, breaks off and travels to the pulmonary circulation and obstructs blood flow to the lungs. An embolus from DVT or deep vein thrombosis is the most common cause of PE. Together, PE and DVT form the spectrum of venous thromboembolism, or VTE. Risk factors for causing PE and DVT are the same. It is based on the theory called Virchow's triad that says 3 factors contribute to the development of venous thrombosis. Please refer to my last video on DVT, where I discussed in detail about Virchow's triad. While DVT is the most common cause of PE, other causes of an embolus include a fat embolism, usually from long bone fractures, an air embolism from injection of large air bolus through an IV or arterial line. An embolus can also form from amniotic fluid during delivery, but these conditions are pretty rare compared to DVT. So, what happens when a blood clot travels to the lung and obstructs blood flow? There will be reduced perfusion to alveoli. Remember, alveoli are the little air sacs in the lungs where gas exchange happens. Deoxygenated blood flows through the alveoli and gets replenished with oxygen and eliminates carbon dioxide. If blood flow gets obstructed, there will be less or none of the gas exchange, oxygen level in the blood drops, and is referred to as hypoxemia. Besides reduced perfusion, blood clots can also trigger immune response at the site of the clots and lead to pulmonary vasoconstriction. Remember, deoxygenated blood is returned to the right side of the heart and then travels to the lungs to get oxygenated and then returned to the left side of the heart and the systemic circulation. So when there is increased pressure in the lungs, the right heart has to pump harder to push blood through the lungs, and eventually, that takes a toll on the right heart and leads to right heart strain or even right heart failure. And there will also be reduced cardiac output and hypotension because of reduced blood flow from the right heart to the left heart. That's why a timely diagnosis of PE is crucial, because PE is a well-recognized cause of sudden cardiac arrest. However, PE can be hard to recognize because patients may be asymptomatic, or symptoms can be mild and nonspecific. Some signs and symptoms you want to look out for include dyspnea, or difficulty breathing, hypoxemia, or low level of oxygen in the blood. Hypoxemia can lead to restlessness, agitation, and mental status changes. There may also be tachypnea, or rapid breathing and tachycardia, or elevated heart rate as part of the compensatory mechanism of the body to increase oxygen. Some patients may complain of sharp pleuritic chest pain, especially with inhalation. That is caused by irritation of the pleura, which is the thin membrane that lines the lungs and chest cavity due to reduced blood flow to the heart. They may have hemoptysis, which is blood and sputum, if there is damage to tissue from the clot. As mentioned earlier, there may also be hypotension due to decreased cardiac output. It is also important to assess for signs and symptoms of DVT, such as swelling, redness, or tenderness in one or both legs, as DVT is the most common cause of PE. If a patient with signs and symptoms of DVT is complaining of chest pain or dyspnea, think of PE and notify the provider immediately. Remember this for nursing exams. How is PE diagnosed? The gold standard to diagnose PE is a CT angiogram of the chest, with contrast injected to allow visualization of blood flow in the lungs. Remember to always check patients for allergies to iodine or shellfish before giving contrast and monitor for kidney damage from the contrast. Treatment. The goal of PE treatment is to increase oxygenation and perfusion. Anticoagulants such as heparin, Lovenox, or warfarin can be given to prevent the clot from getting bigger and to prevent formation of new clots, but they do not dissolve existing clots. Antithrombolytics such as TPA can be given to dissolve existing clots, but they are only reserved for hemodynamically unstable PE, meaning that there are signs of hypotension and heart failure. If TPA is contraindicated, embolectomy, which is surgical removal of the clots, can be performed. Nursing interventions for patients with PE include placing them in high Fowler position, give supplemental oxygen, give morphine as needed to help with chest pain, and decrease the workload of the heart. Monitor for hypotension, signs of right heart failure such as jugular vein distension. Thank you for watching this video. As always, this video is for educational purposes only and not indicated for clinical use. See you next time.